I will present to you my proposed descriptive study on improving education, training, competency checks, and onboarding for emergency medicine nurses. The focus is understanding nurses' perception currently and their educational needs so the organization can strengthen its professional development and improve patient outcomes. This slide shows how the presentation is organized to meet the assignment's criteria. The presentation includes a clear introduction, body, and conclusion. It also includes a background, literature support, participant details like who, what, when, why, where, and how. It includes a rationale for the descriptive design, evidence-based practice implications, and complete references, including 5 peer-reviewed articles. Emergency medicine nurses care for patients with urgent and often life-threatening needs. Because the clinical environment changes quickly, nurses need ongoing education and competency checks to assure their skills. The purpose of my study is to describe nurses' perception of current education, training, competency validation, and onboarding practices. The overall goal is to identify areas for improvement and collect information to guide future improvements. The original proposed assignment in Unit 1 explains that the earlier project was just mainly a practice improvement proposal. It focused on increased education, training, competency checks, and onboarding for new emergency nurses. However, it did not yet include a formal research component such as research questions, variables, sample, data collection plan, or statistic analysis. This background supports developing a descriptive study, in which we have done. The main research question asks how emergency medicine nurses perceive their current education, training, competency checks, and onboarding practices that they are receiving. This question is descriptive because it does not test an intervention or compare two groups. Instead, it seeks descriptive current perceptions and identifies areas that need improvements for the training, competency checks, and onboarding practices. A descriptive design is the best choice because the study's purpose is to describe the nurse's perception and educational needs. It's not attempting to prove that a specific intervention can cause an outcome. A quantitative descriptive data could be summarized in a survey, using the frequency, percentages, means, and standard deviations, but that's not what we're looking for here. Descriptive results can provide baseline information that helps leaders decide what type of education, competency assessments, and onboarding changes must be done. The proposed participants are registered nurses who are currently working full-time in the emergency department. They are the best participants for this type of study because they are directly involved in emergency care and directly affected by training and onboarding processes. These are the nurses who see the outcomes from the lack of training or competency checks. These participants should be voluntary and confidential. The survey can be distributed electronically through staff email, which everyone has, unit communication, which we use GroupMe, or anonymous QR code. The best way to collect data and still remain anonymous is through a structured online survey. This survey may include demographics such as the role of the emergency nurse in the department, how many years of experience, questions about current education or previous onboarding experience, confidence with competencies, priority areas for annual competency validations. Because this is a descriptive study, the analysis can include percentages, frequencies, and means. Any open-ended responses can be summarized by common themes as well. The literature review supports the main concepts of this descriptive study. The 5 peer-reviewed articles address emergency nursing competencies, simulation-based orientation, nurse residency programs, patient safety competencies, and and competency development through training. These sources show that education and competency validations are important to safe emergency nursing practice and patient outcomes. Literature Review Article Number 1. Trezania and colleagues found that emergency nurses require multiple core competencies to provide safe and effective care. This study supports the proposal because it shows that emergency department practices require more than just basic skills. It requires communication, leadership, acute critical care, ethical decision-making, disaster readiness, teaching, and research awareness. I chose this for support because it shows that the competency checks and education planning are top priority. Literature Review Article Number 2 by Rincalo and his colleagues. This article evaluates simulation-based orientation programs from a different view for emergency nurses. This program evaluates novice nurses transitioning to critical care roles in the emergency department. This article supports the study because it shows that onboarding into the emergency department should include realistic practice, teamwork, communication, and clinical decision-making. This simulation proves that it should help nurses build confidence and competence before independent practice in the emergency department. Literature Review Article Number 3 by Muhammad and coworkers. This article reviewed nurse residency programs and found that they can support retention and development of competent and confident nurses. Sometimes in the emergency department, we forget about the retention. Not only are we training nurses to just do the jobs every day, but what about the longevity of the department? This is where this study becomes relevant for onboarding, is not only about learning tasks and teaching skills, it also supports retention, confidence, and professional development, which are very much more important in the emergency department and the longevity. This relies on skilled, stable staffing at all times. Literature Review Article Number 4 by Cake Mom and coworkers focusing on patient safety competencies among nurses. This article supports the study because emergency nursing education should not be limited to task completion. Competencies also include safety awareness, teamwork, communication, and system thinking. These areas are important in a high-risk emergency department for patient care outcomes. Imagine if everyone in the department was going through the motions all day long, just completing skills and tasks and not actually paying attention to the awareness of what's going on with the public coming into the department, what's going on in the patient rooms. These are just high-stakes situations in an emergency department that you must have more experience than just competencies of skills and task. Literature Review Article Number 5 by Nero and Stanalis and colleagues studied how the emergency nursing competencies before and after training. I chose this as my fifth and final article to review for this study because it proves some of the changes that I would like to see in my work environment. This work supports the idea of competency development and how it should be evaluated rather than just assumed. This article directly connects the proposed study because the nurse's perception and competence needs can be guided annually by competency checks and to change future education. Synthesis of the literature. So let's break it down. When we combine the 5 articles considered together, they all support the proposed study. Emergency nurses need clear, competent, structured onboarding, realistic learning opportunities, and ongoing patient safety education. A structured onboarding and simulation can strengthen teamwork, confidence, and clinical resilience. A residency or a transition to practice program may improve nurse retention and competence. Patient safety competencies and education are directly related to patient outcomes. A descriptive survey is a logistic first step because it can identify local needs before the organization decides to make changes on education and onboarding. This will give you a baseline and show you where you need to start with your department. Influence on evidence-based practice and how this study can improve practice and patient care. CUSIN's top priority is always patient safety. Education and skills directly related to patient safety would be improved by this study, especially in high-paced critical care emergency departments where there is not a lot of time for critical thinking and you need to be confident in your skills. In conclusion, the descriptive study is designed to better understand emergency nurses' perceptions of education, training, competency checks, and onboarding programs. The literature supports the importance of competency development and structured transition support. These findings can help guide evidence-based improvements to strengthen programs for nurse preparedness and patient care outcomes. References: course and research design sources. This slide lists the course and research design sources from the assignment. FAIN is included as the course textbook, and the other sources support scholarly writing and research designs. References of the 5 peer-reviewed articles used in this study. This slide includes the 5 peer-reviewed articles added to meet the literature review requirements. They support the need for emergency nurse competency development, structured onboarding, simulated-based orientation, nurse residency support, and patient safety outcomes. Thank you for your time, and I appreciate all the feedback on my presentation. Thank you.